I'm going to talk about how do you describe x-rays. So if you're one physician or a provider talking to another physician or a provider, you need to be able to talk the x-ray language. So these are some things you need to include when you're discussing x-ray findings. The first thing is you must have two views of whatever joint or bone you're talking about. This is an AP and this is a lateral. That is the absolute minimum. Sometimes we get 3 views, sometimes we'll get 5 views of a joint, but you can't just do an AP, you can't just do a lateral. You have to have at least an AP and a lateral. So that's number one. Number two is you want to describe the location of the fracture. Is it proximal in the bone, midshaft in the bone, or distal in the bone? On this x-ray, this is a tibia with a fibula. The fracture line is here, so I would describe this as a distal fibula fracture. It's distal. The next thing you need to talk about is whether it's displaced or non-displaced when you're describing the fracture. This particular fracture right here is a non-displaced. You can see where here's the fibula, the fracture line goes completely through here. The cortex has remained. There's no sign of any displacement. This would be a displaced midshaft femur fracture. Non-displaced distal fibula, displaced midshaft femur fracture. You also need to talk about whether the fracture is angulated or not angulated. And this is really important to an orthopedic surgeon because when I get the phone call at 3 a.m. in the morning when I'm sleeping and you tell me you have a 75-degree angulated midshaft tibia fracture, that means I'm getting up out of bed coming into the ER. If it's non-displaced, that's something you can splint and put on ice. So you want to describe angulation. This is a proximal femur fracture, about 45 degrees angulated. The next category you need to talk about is fracture configuration. Is it spiral? Is it transverse? Is it oblique? And I'm going to show you some examples of each. So this would be fracture pattern. This is a proximal femur. This is a spiral fracture. Can you see how it spirals down the proximal aspect of the femur? And it is slightly displaced, non-angulated. This is an example of a transverse fracture. See how the fracture line goes straight across the bone? So this would be a distal 1/3 tibia fracture, transverse, almost completely non-displaced, at least on this AP view. The next fracture pattern is oblique. And you can see where the fracture pattern goes like this. It goes from one cortex to the next in an oblique fashion. So that would be an oblique fracture. This is the worst fracture pattern to get. This is called comminution or comminuted. And this is where the bone is in at least 3 pieces. And this particular poor tibia is in about 10 pieces. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There's at least 10 fracture fragments here. So this is comminuted. Also displaced and angulated. I'm going to go ahead and give you a test. I'm going to show some x-rays, and I want you to tell yourself describe that x-ray to yourself, and then I'll give you some feedback on what the x-ray shows. This is the first x-ray I want you to take a look at. This is the fracture line right here. These are actually growth plates. It's a pediatric patient. So this is the fracture line. So I want you to tell me which bone. Is it proximal, distal, or midshaft? Displaced, non-displaced, angulated, and then or non-angulated, and the fracture configuration pattern. So this is a distal 1/3 tibia fracture, oblique, non-displaced, non-angulated. Tell me how you would describe this particular x-ray. This is the AP, and this is the lateral view. This is a tibia, tib-fib, displaced, transversed, angulated about 45, probably closer to 25 degrees, midshaft. This would be a femur fracture, mid-shaft, transverse, slightly angulated, possibly 5 degrees, displaced, because you can see it's shortened. This piece should be sitting up here, so there's been some shortening, non-angulated or very, very minimally angulated. Another femur fracture, mid-shaft to proximal, comminuted. There's many, many pieces here, minimally angulated with displacement of the fracture fragments. These are the 5 things I want you to talk about when you are describing X-ray, to whether you're typing it out in your EHR, whether you're dictating into your EHR, whether you're calling another physician on the phone or another provider on the phone. These are the 5 things I want you to remember. You need to make sure there's 2 views, discuss displaced versus non-displaced, degree of angulation, location, proximal, mid-shaft, distal. Talk about the fracture pattern. These are the 4 most common fracture patterns. There's other fracture patterns out there, but this is going to encompass about 95% of the fractures that you see.